Hi everyone, Maddie Langston here, marketing consultant for IDOC. And today I want to take you through some marketing tips on the reopening of your practice after a temporary closure due to COVID-19. The first thing to think through is, from your patient's point of view, what are their concerns and questions about your fully reopening for routine eye care? So you'll want to put a plan in place to answer these questions and answer them through all of the different communication channels available to you at the practice. So for most of you, that is primarily going to be your website, but might also include phone calls to patients, email campaigns through your patient relationship management platform, and your social media channels. So here are the questions I think that are most likely to be top of mind for your patients. The first question is, when are you reopening? So right now, as you're listening to this, you might not know what that date will be, but it's ideal once you do arrive at a date to give people a few weeks notice and kind of generate some buzz around that fully reopening date. Second question is, are there new conditions around booking an appointment? And this might refer to safety protocol concerns. So in other words, are you going to ask me to wear a mask? Can I bring my family, or do I need to come by myself? That's what I mean when I say, are there new conditions? Can you work with me if I've lost access to my benefits, which includes insurance and my vision plan because I was laid off? So thinking through the answer to that question. And then finally, is it safe to come in this year to visit the practice for my annual comprehensive eye exam? What is the practice doing to protect me and my family from catching the virus? So this question, of course, refers to your safety protocol. And really, when it comes to marketing, communication is going to be key around the reopening of the practice. So for most of you, again, that's going to entail phone calls, email campaigns to people, updates on your practice website, maybe updating your Google listing and your Yelp listing if you marked your practice temporarily closed. And then finally, creating some social media posts that have announcements. And I also have a few branding tips on the social media piece as well that I'll share. Now, making phone calls to patients prior to reopening primarily is going to be, of course, for those people whose appointments were canceled because you had to temporarily close the practice for routine eye care due to the CDC's recommendation. So, of course, you'll want to reach out to those people first to see if they're ready to reschedule that canceled appointment. And you might go ahead and be prepared to let them know what your safety protocol is in case that question comes up. So, is this a good time to come in? What are you guys doing to keep me safe from the virus? Do I have to do anything different when I come in? So be prepared to let them know your safety protocol. And don't assume, but if you have them on the phone and they share that they've lost their job and their vision plan or their insurance, be prepared to tell them how you can help. So that might include care credit, access to care credit, or a private pay discount. And then one suggestion from an IDOC member who's also an IMD, Dr. Chris May, he suggested calling your high value patients. And so for his practice, that would include high priority medical, but it might for you mean some other type of patient that is deemed high value to the practice. But go ahead and give that personal touch to personally calling them to see if they're ready to schedule their exam. So your website is really going to be the central repository of information and updates. And this is where ultimately you'll point people if they want to know about your safety protocol, for instance. So even around the safety protocol, I recommend working with your website administrator or creating either a special announcement on the website or a landing page that outlines, here's what we're doing at the practice to keep you safe, and then here's what we're going to be requiring for patients when they come in this year for their annual exam. And I wouldn't be too shy about listing all of those steps out because we all understand that things are different right now, but it is important to kind of communicate those points. When you decide on the reopening date, again, maybe having a special announcement there 2 weeks in advance to let people know when you're coming back. And then if you've changed your hours of operation, you'll want to note the changes. So So some of you might decide to see fewer people per hour, just so that there's less people congregated in the same place there, but maybe you've decided to expand your hours of operation and work later in the day to accommodate patient demand. But you'll want to communicate all of these operational changes on your website. So most of you have access to a patient relationship management platform, and here's examples from both Solution Reach and Weave. IDOC has partners with both of these patient relationship management platforms. You can see on the left, this is an email campaign visual marketing the reopening of a practice. And so if you have Solution Reach, check out their new tools they put in place for your use as part of your practice reopening plan. And then with Weave, there are some operational recommendations there using texting. So if you decide to, for instance, set up a curbside waiting room to cut down on the number of people congregated inside the practice, you're able to use Weave to implement that new process. So check out the great tools in your patient relationship management platform and go ahead and use those in your practice reopening marketing plan. Now, around the branding ideas that I've had, here are some things you might want to push out through email and also on social media. And the first thing is that Eyecare is healthcare. So right now, I think most of us are even more aware of our health than we might be normally, and therefore more receptive to educational materials on comprehensive eye exams. So many of patients do not understand the difference between the refraction and the comprehensive eye exam. And while you might have tried to educate them on the difference before, may have fallen on deaf ears to a certain extent. So this is a good time to educate them on that difference and really emphasize the value of not skipping that annual comprehensive eye exam, how it is healthcare and it is very important. Second branding tip is I don't think you should be overly literal in your imagery. So, you know, most of us have been to the grocery store and the pharmacy and so forth, even during shelter-in-place orders. And we're getting used to a world where a lot of people are wearing masks and so forth. So I don't think you need to be overly literal, but I think you should reference the protocol in place to keep them safe when they come in to see you for care. And so this is a sample Facebook post of what it might look like. And then, you know, if you'd like to learn more, visit our website or give us a call. So you can link to the landing page on your website, and it's just for those people who kind of want to check out the steps you put in place to keep them safe when they come in for an exam. I think right now people are more invested than ever in their local communities, and I've seen a real hunger to support area businesses, particularly restaurants. But I think that right now you might consider carrying on that branding of shopping small and, you know, locally owned, and we're a small business, we're independently owned. I think that's important to carry through over the next few months and thank your patients and thank the community for their support. I think that would be well received right now and is a wise thing to do on social media. So I would counsel you at this point to not use overly fearful or overly literal looking imagery in your branding and in your social media content right now. Like I said, I think we've all adjusted to sort of this new normal, and I don't really care for that phrase, but that's what it is. And so I don't think it's necessary to share pictures of people in masks and so forth to get the point across that, yes, we have new processes in place, because this looks fearful. It doesn't necessarily look like something that I want to sign up to do. And so we don't want to have sort of this fearful looking brand. Rather, I recommend trying cautious optimism instead. So less literal imagery, letting people know that you've missed them, that you're excited about coming back, that you're fully reopened when you do come back. You can reference the fact that you have new safety protocol in place at the practice, but I don't think we need to call out the virus or use those overly literal images in our marketing. So if you'd like to work with me on your specific practice reopening, or you have specific concerns around your practice reopening marketing plan, please reach out to me. mlangston@idoc.net. I look forward to working with you.